Now, to the coronavirus pandemic, CBS News has learned that the FDA could fully approve Pfizer's vaccine sometime next week. This comes as the pace of first-dose vaccination slows for a sixth consecutive day. Experts say full approval may convince more people to roll up their sleeves. Meanwhile, 49 states are now battling high community transmission. The Delta variant accounts for nearly all circulating cases. The strain is devastating the South, in particular, where hospitalizations are spiking. Manuel Bojorquez reports.
Florida has once again broken its record for COVID-19 hospitalizations with more than 17,000 patients. At this rate, 3 out of 4 hospitals in the state could face critical staff shortages in the next week. To ease the crunch, the state says it is setting up more than a dozen clinics for monoclonal antibody treatments.
We've already gotten great feedback from people who went in, were feeling really bad, did it, and 24, 48 hours later started feeling much better.
The virus-fighting antibodies created in a lab do not have full FDA approval. They're given through a transfusion and can help the recently infected who have not developed severe symptoms, reducing the risk of hospitalization or death by up to 85%. Though at this clinic in hard-hit Jacksonville, a photo showed some are arriving extremely sick.
The really key to the success of the monoclonal antibodies is early intervention.
Palm Beach County Dr. Maureen Willihan says the therapy and being vaccinated helped her quickly recover from a breakthrough infection.
It is a game changer at the very least.
But you don't want people to rely on this to not get the vaccine or not mask up or not social distance while there's so much virus around.
No, I'm still really recommending the vaccine in the office. I still think you should be cautious with your masks.
Across the South, health systems are being pushed to the brink. In Mississippi, one hospital is having to set up a second field hospital to handle cases. In Texas, school districts that defied the governor and ordered masks in schools won the backing of the state Supreme Court for now. And while more states and private companies consider vaccine mandates, San Francisco became the first city to require proof of full vaccination to go inside businesses. In Florida, the impact goes beyond hospitals. The city of Orlando is urging residents to cut back on water usage due to a shortage of liquid oxygen, which is used to purify the water, but is also in high demand to treat COVID-19 patients. Lana?
Oh, those ripple effects. Manny, thank you. Dr. Taison Bell joins me now. He's a critical care and infectious disease physician and the medical ICU director at the University of Virginia. Dr. Bell, always good to have you on the show. So according to the CDC, Maine is now the only state without high community transmission. What are your biggest concerns about the virus right now?
Well, thanks for having me on, Lana. And yes, we've seen that the Delta variant, just like it has in other countries, has now become pretty much the predominant variant that's driving cases across the country. We do have hotspots that are concentrated in the Southeast, but almost all states now have high community transmission. So this is the time when we really need to buckle down and reinforce mitigation measures, masking up, social distancing, hand hygiene, all the things that we know prevents the spread of virus, because this is the time when we have a chance to really cut down on spread. And if we don't, then we're just going to have many more people infected, and you'll see more and more hospitals get overwhelmed and seen just like we saw last year.
And we've been seeing a rise in pediatric coronavirus cases and hospitalizations in recent weeks. As we've previously discussed, our own kids and other children under 12 are not yet able to be vaccinated yet. So where are young kids most likely to contract the virus? And what is the latest on pediatric vaccine approval?
Good questions. And this is, of course, personal to me. I have a 7-year-old and a 3-year-old who are about to start second grade and preschool, respectively. So what we know so far about COVID-19 and Delta variant in children, it's unclear at the moment whether the virus is more deadly on a personal basis, but we do know that it's much more transmissible. So we don't know if we're seeing more children that are getting infected and hospitalized because of this reason, or if there's just more community-wide transmission and kids are getting kind of scooped in with everyone else. Now, that does mean that we have to be very careful when it comes to keeping children safe, because we know that mitigation measures work. And as far as trying to keep children safe, some of the best things that we can do is make sure that the adults that are around them are fully vaccinated and that we're still enforcing mask mandates inside, and especially in the indoor setting, and physical distancing. Now, I live in a district that fortunately has been very proactive about these measures. So my son and my daughter are both going to buildings where the adult vaccination rate is close to 100%. They're enforcing mask mandates, and I can feel very safe about that situation despite the Delta variant. But in these areas that have mask optional, low vaccination rates, this is something that's very concerning going into the fall.
Well, the CDC says that there are studies suggesting that vaccine effectiveness may be waning for some people. If that's the case, is there a need for stricter mitigation measures until boosters can be administered?
That's a good question, because the data for the CDC has really talked about vaccine effectiveness, whereas the talking points that the administration has put out to this point has really been around preventing hospitalization and death. And so the data is clear that we do see a decrease in vaccine effectiveness. And what that means is that there's more likelihood of getting symptomatic infection or breakthrough infections the longer out from vaccination that you've had. Now, when we've seen severe cases, they've more often been patients that are elderly or those that are immunocompromised. And that's related to the fact that these patients may not be able to generate an immune response that's at the level that we want to begin with. So talking about boosters and opening it up to 18 and above in a healthier population is kind of shifting the goalposts a little bit. But it seems the administration is trying to get ahead of this, and there's a potential that we could have more severe disease in younger populations, and that's why they're focusing on trying to open up boosters. But of course, in the meantime, we have to keep in mind that vaccination is not going to be the way out of a surge. We really have to stop the chain of transmission at the moment, and that means trying to prevent the people infected tomorrow from getting infected. And that's why mitigation factors are so important. We really can't put our eggs in one basket here. We have to pair vaccination with masking, physical distancing, hand hygiene, and all the other things that we know that works. This is how we really turn the tide of the surge.
Really need to use every tool in our toolkit for this. One more question, though, about these booster shots, because earlier this week, the Biden administration recommended recipients of the Pfizer and Moderna vaccines should get booster shots 8 months after initial vaccination. But some scientists have argued that this decision is premature and that it also might promote global vaccine inequity, which is something that you and I have discussed previously. So I'm just wondering what's your take on that?
Well, this is certainly a concern. And whenever you are thinking about what's the best use of a next dose of vaccine, we really have to ask ourselves the question, is the best use to boost someone who may be young and healthy, who already has a low chance of being hospitalized with COVID-19, or is it better used going abroad? And so the criticism from the WHO, I think, is founded in the fact that when we look globally, we have 3/4 of the global population has not been vaccinated, and that includes only 1.9% of developing countries. The entire continent of Africa only has 2% fully vaccinated at this point. And so not only does this look it's very poorly reflective of our global priorities, but it's also short-sighted. We have to remember that the booster shot campaign has been driven by a variant that developed in a country that had a low vaccination rate. And so as long as we have several spots around the globe that have low vaccination rates, we are just as susceptible to having another variant that might put us right back to square one and having this conversation all over again.
And of course, people here in the United States who haven't gotten their first vaccines need to really be thinking about the implications of that decision as well. All right, Dr. Taison Bell, thank you for joining me, and thank you for all that you do.
Thank you.